My name's Joan Doyle and I'm a Sister of Mercy and I'm currently working in Lima, Peru. I'm working with Patricia McDermott and Jackie Ford, two other Sisters of Mercy. We're all from the North Sydney congregation of Sisters of Mercy, and we're working on the outskirts of Lima in a very impoverished area. In a lot of the area there's no running water and no sewage, so the water has to be trucked in and then has to be boiled. There's no refrigeration. There is electricity, but most people couldn't afford to buy a refrigerator.
I suppose when I came here and saw the lack of resources for the women, I really felt that we had to do something. So I planted the idea with them that would they like a house that they could feel was their own, where they could come and learn some skills, knitting, sewing, crochet, these cottage industry skills. And they responded really, really well.
The first house to be established was Catherine McCauley House in Tres de Mayo. That was started by Jackie Ford about 10 years ago. And the Candela House, Mother of Mercy it's called, it was started in 2000, beginning of 2000. And more recently, we have another women's house in Wandoi. It's called Service and Solidarity. We've got together a group of women from the three women's houses. They're very skilled and they were given very intensive training in how to use knitting machines professionally. And our hope is that we'll be able to commercialise those products. Another very interesting initiative was the Heifer Project in Serra Candela. That was a program whereby the women learnt how to raise guinea pigs and other small animals like chickens, rabbits, and they also learnt how to market garden. So the whole idea was that they improved the nutrition in their families and also hopefully might be able to sell some of these animals to raise money.
Just down the street from the women's house there is the children's house. We have a children's house also called Mother of Mercy Children's House. We found that there were so many women who were either not able to come to classes because they had nowhere to leave their children, or else some of them were so keen to come to class but they were leaving their 3-year-old locked in the house by themselves, and we thought that's not on. We decided, what's needed is a safe place for children while their mums are studying or learning new skills.
As well as that, we run an education program for the parents, so we try to educate them in nutrition, hygiene, other health-related issues. The health service has expanded. We began in the women's house 6 years ago, and due to the demand and also fortunately thanks to some generous donors, we've been able to relocate the service and build a beautiful new centre. The inauguration was a wonderful day. We had our donors present and we had representatives from the Australian consulate and we had visitors from Australia and lots of Sisters of Mercy, and most importantly we had lots of local people. So as well as general medicine, which is offering every morning and afternoon, we've also been able to include some specialist services. The aim of our health service is to offer a service that gives professional treatment at low cost and that treats patients with dignity and care and compassion. One of the challenges for the medical service is the financial sustainability into the future. Because we've got a professional staff, obviously we need to have that to offer a quality service, that costs money. And because of the area that we're in, we don't want to have to raise the fees for the patients because our philosophy is that we want to be able to serve the poorest always. And we never turn anyone away who can't pay. The economic sustainability of the centres is obviously a very important factor and it's critical for the future of these centres. In the beginning, our challenge was to find funding for these centres and also to offer leadership training to the people because our idea in the end is that we empower these people to run the services themselves and they become independent. In the women's houses, we've made great advances in that regard. Those centres are up and running, the women are confident, responsible, and they're going very well. In the childcare centres, they're proving quite costly to run because many of the children who attend those, their parents are very low or no income. So the ongoing financial costs of those is a concern to us. I'm really keen for people to know about what we do because I believe it's a very challenging mission and there's great need there, and I really believe that those people, they have a right to education, they have a right to good health care and reasonable standards of living. And if we're on about achieving the Millennium Goals, there's every opportunity to fulfil those by supporting what we're doing there.